Let's bring in some medical experts, infectious disease doctor and senior scholar at Johns Hopkins Center for Health Security, Dr. Amish Adalja, and physician and fellow at the Brookings Institution, Dr. Kavita Patel. She's a former White House health policy director under President Obama and an MSNBC medical contributor.
Dr. Patel, talk about the concerns you have right now if you were treating Donald Trump as a patient, and also the concerns we should all have as Americans with a man who is still, according to his own doctor, fighting COVID and not out of the woods yet. What concern should we all have?
Yeah, Joe, it's a great question, and good morning. Any patient, not just the president, but any patient that's still in the early stages of COVID-19, and given all the treatments he's received, we have to believe that, and with the video you showed and kind of the labored breathing, we definitely know he's not out of the woods is the least of it. We know that this disease can progress and it can decline at any moment. So I would be incredibly concerned, and that's why I think you saw the pool reporters pressing for lab values, results of scans. We need to understand, is his viral load decreasing, or is he in fact what we suspect, shedding virus? And I just have to keep pointing, you've talked about it before, Herman Cain, who attended a rally maskless and actually was diagnosed and then said he was improving. And it wasn't until about 28 days after he was diagnosed that he died. So you can imagine the trajectory of a COVID-19 patient is incredibly tenuous, not just for those 10 days, Joe, but it can persist for weeks. And then I think, to your point, what's even more concerning is the risk he's posing. And you think about just the transitions from Walter Reed to Marine One, back to the residence. Each of those transitions increases probability, touching surfaces. We now know from his own CDC, which he chooses not to listen to, that this is airborne and that it's not just 6 feet that can protect you. So there's an incredible risk. I think Mika said it best, a super spreader event at the Supreme Court nomination, but a potential for a series of super spreader events if he has even limited staff. But those staff, Joe, they go out, they interact with people. It's not that they're living in bubbles themselves. And if he does choose to campaign, even if he feels better, we've seen patients who shed virus as late as 37 days after diagnosis, even longer in some cases.
So, Dr. Adalja, as a physician, what questions would you have for Dr. Sean Connally if he comes to a microphone again today to update the country on the condition of the President of the United States? He's shared bits and pieces of information, but completely ignored it or elude other questions. What do you need to know from the White House physician today?
I would like to know just a basic chronology, just the way you would present this if you were at a hospital talking to another doctor. So I would say, when was the president positive? When was he negative? When did his symptoms start? What was the lowest his oxygen level fell to? We know they're talking about 93, 94, but the question is, did it ever fall into the 80s? We heard it was never in the low 80s, but was it in the high 80s? Why wasn't dexamethasone started early when he first required supplemental oxygen, which is standard of care? Then I want to know what we're on his chest x-rays. What is the expected finding? The expected finding to me is pneumonia. So why not just say that he has pneumonia on his chest x-ray? Then I want to know what his blood work is. What is his lymphocyte count? What is his C-reactive protein level? What is his D-dimer level? All of these things, which probably don't mean that much to your viewers, but they tell us how severe his illness is and what the trajectory might be. That's all very important to understand whether a person will get into trouble 7 days out, 8 days out, but we really don't know any of that. And I know there's HIPAA concerns, but I do think it's important, if you're going to say that you don't need to be afraid of this, that this truly is a case that's not going to get severe. It's clearly not a mild case, but it's somewhere in that moderate level, but we don't have enough granularity to be able to speak really definitively about what the president's prognosis actually is over the next several weeks.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.